Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have Dr. Farzana Islam, who is a professor, head of department in community medicine, Hamdard Institute of Medical Science and Research, New Delhi. A very warm welcome to you, ma'am, on behalf of all the audience.
Thank you so much, Dr. Ritu, and thank you to everyone for inviting me for this talk, for this interview to talk on this particular very important topic, and I'm really very much obliged. Thank you.
Our pleasure, ma'am. Today we are going to talk on a very serious topic, actually, and yet important. Today we will talk about cervical cancer, which is very much important
Yes,
for our generation, for the females society. So I would like to start my session with my first
yes,
question, ma'am. That
yes.
what is cervical cancer?
Thank you, Dr. Ritu. Yes, cervical cancer is a very important upcoming, it is very important. It is a cancer of the cervix, as you all know. It is the cervix. It is the opening of the uterus, and when the cancer starts in the cervix, that cancer is known as cervical cancer. And we all know, maybe we know that cervical cancer is caused by virus, a very particular kind of virus that is known as human papilloma virus. So, and it is very important that we should know about cervical cancer and how we can prevent it, we can treat it, and what are the different ways how we can treat and we can be safe from this particular disease.
Ma'am, can you please elaborate some symptoms of it so that a person can be aware of it that she might be having a risk of cervical cancer?
Yes, Dr. Ritu. As I mentioned earlier, that cervical cancer, it is the fourth leading cause of death worldwide among the women, and in our country, it is the third leading cause of death. Okay, so uh, WHO has already taken a resolution that we should be eliminating cervical cancer by 2030. So we all should know what is cervical cancer, how we can prevent, and how we can diagnose or treat. So if you are asking about the symptoms, as such, when the disease starts in a very early stage, there might not be any symptoms. Okay, but but the onset, when it starts, it is mainly in the after the age of 35 years of age, the cancer may start. Okay, but when you talk about the symptoms, like maybe there might be some spotting or bleeding after the sexual intercourse, or after the menopause there may be irregular bleeding, or maybe in between the periods. Okay, sometimes there might be some vaginal secretions which is order, or this kind of symptoms may appear, but very early stage there might not be any symptoms. So that is the most important part, because we can prevent it, we can screen it properly in a regular interval, and so that we can prevent that particular disease.
Okay, ma'am, just out of curiosity, as you are saying that it is just it happens because of virus. So, if any lady have this, unfortunately, if any lady has this cervical cancer, so if another woman comes into contact, if she might also get this disease or what?
No, no, cervical cancer is not a contagious disease or something like that, that people will come in contact and they will get it, the other persons will get it. So that's why we have to know why it is being caused. So as I mentioned, cervical cancer is being caused by a particular virus. Okay, so and another important fact which we should know, that when before before the exposure, like when after the early sexual intercourse, the risk increases. Okay, so it so for the prevention also, when we were talking about the vaccines and everything, we should know that when the vaccine should be given. So, and out of there are many subtypes of HPV virus. That is the misconception, that people might not know that cervical cancer is caused by virus. That is one of the most important thing that I think our common people does not know. So that is a very important information that should be disseminated to the common population. And it is not a contagious disease. It is not infectious that one woman will be contracted and it will be. It is most the route of transmission is the sexual route. After the sexual exposure, only the woman is more prone to the disease.
Acha, okay, so we know that we can prevent this disease. We will talk about it
Yes.
later, but once I want to know that is it curable, and if it is, that the treatment is very costly or not.
Okay. So as we are talking about cancer, we all know that for prevention of cancer or for the treatment part or everything, it is the early diagnosis and the prompt treatment. So even we are talking about if we'll be talking about the prevention part later, but when we are talking about the treatment, okay. So cervical cancer, if it is diagnosed early, it is one of the cancer that can be cured completely, okay, but if it should be diagnosed in the very early stage, and that for that particular diagnosis we should go for proper screening. Okay, we should be able to every woman should be encouraged for screening. WHO has recommended that women above the age of 30 years, they should get screened through pap smear or DNA testing for the cervical cancer every 5 to 10 years. Or if any women who are HIV infected, they should also get screened from the 25 years of age and every 3 to 5 years. So the screening is very important. If the cancer gets diagnosed at a very early stage, then we can completely the this disease is curable. It is almost like it is one of the cancer which is actually curable. But one
And
most important thing is that it should be diagnosed in a very early stage.
hmm, the treatment is costly.
And
The treat
treatment is, like if depending on the stage of the cancer, if it is detected very early, only the like surgical interventions and maybe the chemotherapy, it is almost like the way the other cancers are treated. Cost depends on the type of interventions are required at that particular time. So depending on the stage of the cancer, the treatment cost will, maybe it is reasonable or it may also go very high. But we should know that we should not reach to that stage, because it is a disease which is actually curable or preventable.
Okay, ma'am. So, just my last question with you, ma'am, that how can we prevent it and what are the other options?
Yes. Yes, first of all, as I mentioned, that for prevention, screening is very important. So we should encourage everyone of women above 30 years, they should screen themselves. Prevention, as I was talking about the prevention. So for the prevention, as I mentioned, screening is very important. Detection of the cancer at a very early stage is very important. And one more important tool we have, that is vaccination. So cervical cancer, for HPV vaccination, to prevent cervical cancer, we should encourage for HPV vaccination. And the most important thing that HPV vaccination is very effective when it is given at a very early stage, like at the age of 9 to 14 years. So WHO has also recommended, even in the last year only, WHO recommended that even single dose of HPV vaccine is very effective in prevention of cervical cancer. But most important is that people doesn't know much about that HPV vaccine can prevent cervical cancer. That we should disseminate this information to the general population, that vaccinating children, girls at the age of 9 to 14 years, even with a single dose, can prevent cervical cancer in their lifelong. And many countries has already introduced free vaccination in their immunization schedule. Our in government of India is also planning in the near future to introduce HPV vaccination in our immunization schedule. So HPV vaccination is a very important tool we have to prevent the deadly disease.
So, is it mandatory to have this vaccine in the age of 9 to 14, or in at any age a person can get
Yes,
this vaccine?
yes. No, it is very important that before the sexual exposure, if the vaccination is taken before the sexual exposure, because it is expected that after 14 years there might be any kind of sexual exposure. So before the sexual exposure, the vaccine is very effective. After the exposure, already, if the person gets exposed to the virus, the vaccine will not be that effective. But before exposure, that vaccine is very effective.
Thank you so much, ma'am. Thank you so much for this talk, for this awareness, for the citizen health interview. Thank you so much for having us.
Thank you so much, Dr. Ritu, and thank you for inviting me.